Okay, let's try this again. This morning I did a video on the US's Donald Trump's response to the coronavirus and analysing that from largely the scientific perspective. And then later today I did one on the UK response. That video cut out halfway through. So, joy of joys, I'm going to do it again, repeating what I said before, but then sort of finishing it up, hoping that the video doesn't get interrupted again. So what I want to talk through is basically the fundamental understandings that I think people should have. So this isn't about casting judgment or offering support or doing all of those adversarial things that I see a lot of the commentariat doing, but rather from the scientific perspective, what is herd immunity? What is flattening the curve? What is the UK strategy combining these, as it were, and then why is the UK an outlier, and then my sort of take on how that has been communicated so far, and what are my predictions for how the UK government will behave now. Right, so let's start with this thing called herd immunity, which I think was misunderstood from the get-go, and it could do with some explanation. So you have to factor into this that it's not a case that the government wanted the virus to go charging through the whole population, knocking out the older generations. You've got to see this in the context of also cocooning the vulnerable people in the population. So if you're cocooning off those that are older, those that have got cardiovascular or respiratory diseases in their care homes or in their homes or in secure environments, and once you've got that cocooning process in place, then if the virus is coming in and propagating through the rest of the population while these guys are cocooned, then think of it like a scorched earth thing, that it's getting through all these other people, those that are younger and healthier and that can actually take it, and it passes through them like a light disease. And then after that, they have immunity because their immune systems have reacted to it and embedded that. And it means that at the end of that process, when you've got 60% or 70% of this population that have had it, then these guys who are more vulnerable can come back out into the wild, as it were, and they're safe because of the herd immunity of the people around them. So then if coronavirus is coming in again from outside, people coming from other countries where it's high, or if it flares up again in winter, and that's what the government and all governments should be worried about, what about a winter flare up? Then if you've got that level of pre-exposure in society at large, then it buffers these people, the more vulnerable people, from being hit later. So that's the idea behind herd immunity. But is it a sensible thing to pursue as a policy at this stage? That is more debatable because it carries risks with it. Most people would respond to a pandemic, an epidemic, by trying to slow as much through strong measures at a very early stage the propagation, rather than wanting to encourage it to go through, even at a slow burn, all of the population, so that you buy more time and so that you, as we'll later see, flatten the curve. If you're allowing it to propagate, then you run the risk that you're encouraging a peak, which means that you'll have more cases at one particular time, maybe more than the bandwidth of your NHS can handle. You'll cause that peak to happen earlier, which begs the question, you actually prepared yet with all the equipment that you need? And then you're taking a gamble on that cocooning process working really well. If you're trying to actually get to over 60% of the wider population being exposed to it. Then there's also a question of whether the immunity sticks with this particular disease. We know from those that have recovered so far that they retain an immunity to it, but the maximum time that you're looking at for those that have got it is 1 or 2 months. We don't know if this lasts 6 months, 7 months, what have you. So as the British Society of Immunology wrote to the government, you can't bank on that just yet, right? But that's the concept of what you're thinking about with the herd immunity. It is making society at large safer for when vulnerable people are around after the major peak of the flare-up. The other thing is, of course, flatten the curve. This one you'll know already. Let me just add something to it that you might not have seen. And that is, if you've got your usual sort of epidemic peak and sort of drop off, then you've got a proportion of those people, like 10%, that will need to be hospitalized. But you want to stretch all of this out even more, so that those people that need to be hospitalized stays at a sort of even and low number under the level of what your NHS can handle. That's the whole idea. But bear in mind, as we talked about with the herd immunity thing, if it races through your population quickly, then you only have to protect the vulnerable for a shorter window of time than if you're actually deliberately stretching it out for a long time. And so that's the kind of trade-off that you have to look at. And this is one of the tricky things, which is how long can you keep, you know, the old, the vulnerable, those with cardiovascular and respiratory problems, actually isolated for. That's the tricky thing. That's what the government has to balance. That's what all governments have to balance. And so this is where the different modelings of where we are in different circumstances come into play. And so, you know, the chief scientific advisor and the chief medical officer will have all of this information to hand, and they will be doing their best guesses up front, but the data that come into them is going to change over time. And also, an important factor with all of this is how they communicate with the public, and then how the public are responding to their communication. So all of this needs to be factored in. Now, knowing those two principles, let's talk about the UK approach. One of the things that makes the UK different is, at an early stage, this notion of herd immunity was sort of leaked out to the press and then widely discussed, and was also played up by Boris Johnson, who got asked by Philip Schofield the very straightforward question of, is all of this washing of hands and social distancing in order to slow things down and stretch it out so that we don't overburden the NHS? To which the answer should be yes. However, Boris Johnson decided to say, well, actually, there are some theories that you should take it on the chin and allow this to propagate through your society rapidly and not put in the draconian, costly measures so that you take the hit more quickly and then you're into different territory. And we think we should blend this with, you know, other more traditional measures, as it were. So that kind of spooked the horses somewhat, in terms of spooked the scientific community parts of, and also wider society. And it was clear to people that this kind of thinking, which is high risk, was being contemplated at those kind of levels. The other thing that makes the UK different is, now that we are moving from a contain phase into a delay phase, we are doing less testing, whereas countries like South Korea are doing tons of testing, about 10,000 tests a day, really, really thorough testing all over the place. So that has spooked some people. Why would you wind down on the testing? I'll come to that in a bit. And then the other thing which makes the UK an outlier is refusing to shut schools at this stage. Now, the response in China, when they got a grip of it, was then to put in those very, very strong measures of shutting down schools. We also saw that in South Korea, and then we saw that in Italy, and now across Europe. And so the UK has been a bit of an outlier by saying, in terms of thinking about the behavioural science of this, we don't want to take too strong measures too early because we want to play things at their right time. So there have been some people that have supported the government in this and others that have questioned parts of it. To address those issues, one with the herd immunity stuff, that is probably far too early to bring into the discussions. It is not really appropriate for this stage to have a look at, to plan on herd immunity. I think most people would agree that what you want to do is delay as much as possible the propagation of the virus, so that you've got more time to prepare your national health system and your services and your policing, and what other social measures as regards to payment in the gig economy you need to bring into place. So that was a bit of a curveball, which was maybe poor communications done, with that aspect too early. With regard to the what was it? The testing. That is one where I have talked to professionals who've said you don't really need to do it as we move into this phase, because you can extrapolate from the hospital data about how many people in whatever constituency or county actually have the disease. We are professionals at modelling. We can model this back. You don't need to spend the extra money on the testing. However, more testing is obviously more information. South Korea have done a fantastic job on testing everyone. It's rich with information, and also for individuals themselves to know whether they had flu or whether they had coronavirus. That can sometimes be important in informing their decisions going forward. So the government has started actually to roll back a little bit on that one and expand the testing in some critical areas, I think, for example, with the health workers. Now, the other one with regard to closing schools is a tricky one. Most of the other countries so far have taken the strategy of play for as much time as possible, shut things down, and make sure that you're really stretching out that curve. Now, we know, for example, that with influenza, kids are super spreaders of it. We don't know that that's the case with coronavirus. Also, we know that if you take kids out of school and have them at home, then that pulls their parents out of the workplace as well, which can have real economic damage. And there can also be hefty social consequences associated with that as well. And if this goes on for a long time, then that exacerbates the damage. So the government is making the argument that more time before you implement the measure means that the measure is more effective when actually you do implement it, and it has lesser economic damage. But others would argue you shouldn't be gambling on that, and rather you should be introducing these measures as soon as possible in order to buy more time. Now, my take on all of this is that it's important that we don't politically slide left and right about all of this, and we do follow government advice, and we do take that social responsibility not to, for example, clean out all of our stores and shops, and we do wash our hands, and we do stay calm. And the government will adapt its strategy according to information coming through. The communication so far has actually not been that great. The herd immunity leaks, and then what Boris Johnson said, did somewhat spook the public. It was then a smarter move for Boris Johnson to be there, flanked by two medical and scientific experts. I note that Donald Trump, after he screwed up with his presentation, then copied the UK and adopted the same policy of being flanked by actual experts that he could defer to when needed. I think that with regard to the school closing, also there's a very important dimension here, which is the public need to be able to trust the government and believe that the government is taking swift and strong measures appropriately. So there will be pressure on the government, particularly as cases rise, for them almost to fall in line with the other nations and start actually closing the schools and saying, no, we're not gambling this, we're going to close the schools and then we'll deal with the economics, but we must have maximum time to help the health services prepare. And another thing that I would actually argue with regard to that is we are in a fortunate position in that we are laggers on this. We've had China go first, and South Korea, and then some countries in mainland Europe like Italy, Germany, Spain, and not others, Poland and so forth, but we've had others go before us. So with issues of whether people are capable of staying at home and self-isolating, or kids are capable of being kept away from schools, or whether there is enough unexposed people in communities for another flare-up to occur, those are going to be challenges that we see in China, South Korea, and mainland Europe first. So we would do well to copy the best strategies of them, which is probably South Korea would be the best example, and then follow their lead rather than trying to be too clever and too different too early on. That would be my thinking. So I think the government are starting to move in that direction because they don't want to spook the science community and they don't want to spook the public. So my prediction here is actually that that's the kind of thing that they're going to do. They'll probably increase the amount of testing or testing facilities available for those that want it or need it. They will be looking into cocooning measures for older and vulnerable populations. They will be looking at how they prep the NHS with more physical equipment and staff, and then they will be looking to actually implement some of the measures that other countries are putting in, but telling us as the public that they waited for the appropriate time to do it for maximum impact. And then we're just going to go through the same things that other countries are going through, and it's going to be horrendous, and it's going to be tough, and it's going to take us actually having that community spirit where we're all looking out for each other and doing the right thing. And up front, a huge vote of thanks to all those companies that will be doing what they can to help out, all the doctors and nurses and everyone working in the health services that are going to really expose themselves to risk for the sake of the rest of us. It's going to be a real test of us as a community. And I think as we discuss this going forward, and as we discuss the science going forward, I think it's important that we all work to understand what's going on, work to understand the dilemmas that are going to happen, that it's going to be natural that in some areas of the country it's going to flare up more than others, and rather than pouring blame, and as journalists or articles may do, rather we look to the best examples of what we're doing as communities around the country and look to copy that, and look to copy the best practice around the world as well. And I think that's how we're going to get through it. Okay, done. That's all I've got to say. But if you've got any comments, drop them in the below and we will continue that discussion. Right, so new update late at night. I've just done this on Twitter. I shall repeat it on Facebook. It looks like the government messed up with their modelling, have only just realised it, and this is why they are backtracking. So there are various academics that fed into government strategy, and a modelling team from Imperial had developed a lot of models that the government was basing their strategy and their ideas on. And we can see now that it was actually the herd immunity strategy that they were thinking about very prominently, because they thought it was clever and it looked different from the other countries, and they thought that it was more scientific and had a longer term view because it was about handling secondary flare-ups rather than just trying to delay things. But the problem is with this model, if that's what you're planning on, then it's a key aspect if you overwhelm at an early stage your National Health Service. And what it looks like went wrong with this particular model is that the virus they were using as an example has about half the intensive care rate of what we're actually now seeing for COVID-19 coming out of Italy and coming out of the early cases in the UK. as well as elsewhere. And that means that in the model, if the government had gone ahead with its original strategy, then that would have flooded the NHS capacity, particularly the intensive care capacity, very, very early on. There would have been overspill, and it would have caused, according to the model, about 250,000 deaths. So the government have now realised, apparently in the last few days, that this strategy is not smart, and they have pivoted quite dramatically now to advising all of those social distancing measures that they were very slow to adopt before. So to go through what I said in the video, I don't think it was yesterday, it was the day before, to explain the herd immunity strategy, because this is clearly now what the government were planning on before they disowned it. It's a neat idea, which is essentially you've got vulnerable people in your population. You cocoon them off, you know, the elderly, those over 70, those who are pregnant, those who've got respiratory or cardiovascular conditions. You make sure that they are isolated, and then you let the virus pass through the population amongst all those others, like all the school children. Keep the schools open. Government can't say it, but that helps actually propagate it amongst those who are healthy and can take it throughout the population. And then importantly, quite soon, when the fire has moved through the population, those people in cocoons can come out, and even if more COVID-19 cases sort of come in from abroad, or if there's a winter flare-up or something, because this is all burnt land, it doesn't catch through and it doesn't get to everyone, particularly the vulnerable. And so at a later stage, you have got population a lot more protected as you go into winter. And it's also nice as an idea, because then you take this on the chin quickly, and it goes through quickly, and then there's less economic burden because you're employing less draconian measures, and it all happens more quickly. And in terms of flattening the curve, what you're doing is, you know, if this is at your peak where it's just completely laissez-faire, and then this is a stretched out peak, what you're really interested in is that population that could die or certainly have to be hospitalized. 1 in 10 will have to be hospitalized. And then if you let it burn quickly through the rest of the population, apart from these people who are more vulnerable, you're only protecting them for that period of time, right? Nice. Rather than having to try and cocoon them and protect them for a much longer period of time, like what China and South Korea and the European countries are doing. And furthermore, you get complete burn through like this, whereas if you stretched out longer, then at the end of the day, only a lower proportion of people will have been exposed to it, so there's more opportunity for flare-up. Nice in theory, but here are the problems. Firstly, if your cocooning strategy isn't watertight, then you're causing a big flare-up around these people, and if it doesn't work well, then you're getting a peak which is way beyond what your NHS can handle. Secondly, because you're starting it earlier, you're actually hitting peak earlier and a more dramatic peak, and that's going to take out some of your workforce. You need to make sure that your NHS or your National Health Service in whatever country you're in is prepared, fully prepared at a much, much earlier stage than if you're working really hard to delay it as long as possible so that you can get in all of your ventilators, all of your staff, all of your protective equipment, all of your, you know, extra designated space for ICUs, what have you, right? And then there's an issue with the immunity itself, and that is that we know with COVID-19 it does produce immunity for those that have it, but we can only see 2 months maximum because it's a very new disease. And with some viruses, the immunity comes and goes very quickly in a matter of, you know, a few months or half a year. And with others, it's much, much longer immunity, which is raised by exposure to the virus. So you're taking a gamble that that's going to be, you know, in place later, if that's your strategy. Meanwhile, you're exposing all of these people, all of these extra people, to that risk that is supposedly healthy, but as we've seen, it has actually killed some younger people and children. There was the example, for example, of that paramedic, 47 years old in Italy, who had no underlying conditions, and he is now dead, leaving behind an 8-year-old child. So there is risk in that. And the problem, as I said before, with the modelling is that, models are only models. You can get things wrong. In this particular case, the modelling was done using a virus which had half the critical care, intensive care beds needed rate than actually what we're seeing with coronavirus, which means that instead of balancing it artfully in order to be under NHS capacity, rather when the model was sort of rerun with that new information being taken into account, then you trip that level very, very quickly. Your intensive care units around the country just don't have capacity. You get the overspill. You have to make decisions about who lives and who dies, and then the end result being, 250,000 people dying, which is why the government probably flipped out about the ventilators, because we've only got 5,000 in the country. Germany have got 25,000 intensive care beds with ventilators, right? So we're well behind the game on that. We've got very little time in order to get them ready now, and that's why there's this big national call out to Rolls-Royce, JCB, anyone who can help manufacture them, because the government realizes that not only does it not have enough bandwidth according to the original model, but now if there's overspill, then it's really, really problematic. And so that will explain that panic, and it also explains the drastic measures now in order to, instead of go on a trajectory, which is, to be fair, somewhere between the two, but actually to rather now put in the social distancing. So we're really trying to get no spread until as late as possible, so that we can make sure that the NHS has all the protective equipment, has all of the ventilators that are needed for the intensive care units. And this is why the government is now also admitting that for those that are elderly and vulnerable, then the time of quarantine is going to be much longer, several months in some cases, and are now admitting more publicly that this is going to be with us right throughout, the full year. So that's where we are. I'll say this, I tried to talk about these things, calmly and nicely and informatively, rather than politicizing it all. But there has been a certain attitude associated with the government, which is, we're doing science, the rest don't know what they're doing. A sort of British exceptionalism, and I resent science being pulled into this, that feels to me very Brexity. We're better than them, we don't need them, we can do this by ourselves. Whereas the reality is very different. We do need to borrow equipment from other countries. We do need to follow the example of other countries when they do things well. We do need to cooperate with other countries. We are not better than other countries. We are all in the same mix together. And we actually have a perfect opportunity here. We are lucky in this country that China has gone first, then South Korea has gone, then other European countries, and we're sort of midway with the European countries, but we're lagging on this whole process. And the more we can string it out, the more we can watch what countries like China and South Korea are clearly doing successfully by early tons of testing, imposing draconian measures, getting the virus under control, clear containment, and then we should be copying that with all the heavy testing, with all the containment, following their lead, because they've clearly done a good job so far. And then with regards to flare-ups that come later on, well, China and South Korea are going to have to relax their stringent controls earlier than we do, or try and keep them in place and see the natural behavioural relaxation happen earlier than we'll have to see. But we can follow that lead and be informed by that. And we do not have to go charging off, inventing our own strategy just to be over clever when it is high risk and it does put more people in danger. So I think this is actually quite a cautionary tale about British attitude, and I know that the government now is pivoting strategy. One, because they've seen they've screwed up. Two, they've been losing the faith and support of the scientific community in the UK. And with that also the public, because the public are wondering, why aren't we putting in the same social measures as other countries? And I also know that UK representatives have been lambasted by experts from other countries who are basically saying, like, what the hell are you doing? So it is sobering and it is a cautionary tale, but the best thing that we can all do now is actually fully impose as much social distancing as we can all do, you know. So be reasonable when you're shopping, help your neighbours if they need it, minimise contact, work from home if you can, and if other people are in difficult situation financially or socially or with regard to mental health or whatever, think about what you can do to help them, because at the end of the day it is about community. So let's do what we can. It's going to be a tough slog. Okay, thanks. Good night.